a lot of people have concerns about black fungus. And many people think that black fungus is something that is fundamentally ENT. But there are some people asking that we are hearing it's affecting the eye also. Now, you're the chairman of ophthalmology at Medanta, so who better than you to tell us, are you seeing a large number of black fungus cases? Is it affecting the eye? What should people do?
Thank you, Vikram, for having me on the show. Yeah, we are actually seeing a lot of people, coming to us with black fungus. And this has had a sudden surge over the last about just over 2 weeks now. What has been asked is, how come we did not see much of it in the last COVID wave? And what has become so different today that we are actually seeing so many cases? Now, there are a couple of factors, which I want to sort of enumerate. But before that, I want to clear a common misconception why it is called the black fungus. Now, the fungus is transparent. It's not black. So that's one thing which you need to know. The reason why it is called a black fungus is because it actually invades the blood vessels, okay? And once it invades the blood vessels, it actually causes tissue necrosis very, very rapidly. Because one of the factors which it actually sort of thrives on is the availability of the blood and the iron in the blood. So once it causes that, there is eschar formation and necrotic areas, which are typically sort of, typical evidence of what black fungus is or mucormycosis is. So mucor essentially is found normally all over the soil and everywhere. The spores are hanging around everywhere. Our immunity normally is very good to take care of these spores. But what happens is that in COVID, firstly, the COVID is attacking our immune system in a very intense manner. So we are seeing with the intensity of the COVID increasing in this wave, the immunosuppression which it is causing is actually become much more. The second factor is increasing use of steroids. The steroids are being used I would say indiscriminately. And it is becoming a problem because not only are people doing, say, more of teleconsults and tending to give more steroids, there are many more complications being seen in this wave of the COVID. And as a result of which, the amount of steroids being ingested is much more. Third factor.
Yeah, sorry, carry on.
Important is self-treatment by a lot of people going on the net and taking steroids on their own. So what this is doing is actually changing your blood sugar levels to a great extent, which makes the fungus thrive in the human body very, very quickly, and it spreads very fast. That is one of the fundamental reasons why we are seeing such a rise and increase in number. The last point I'd like to make, the number of cases we are seeing have increased from maybe 1 or 2 a month earlier to now approximately we had seen about 17 cases in the OPD today, about 14, 15 yesterday.
We do not have, unfortunately, standardization of prescribing patterns of the providers. Quite a number of our providers are also GPs and all that, which use right, left, and center the steroid part of it also. And secondly, Vikram, which I think Doctor will agree with me that basically Sudipta will agree with me that also now we are having a burden of lifestyle diseases and a lot of people are coming with diabetes as well. So probably it could also be one of the reasons, Dr. Sudipta, that people are, suffering more from this infection and along with, use of steroids and all that, that is raising the blood sugar levels more. So that is another distinct perspective of mine, which I feel that we must focus on lifestyle diseases as well.
But I just also like to ask you, attacking the eye, is that a common presentation or is it mainly in other places? Because we are hearing of people going blind and we are hearing of people having to have their eyes removed, literally, surgically.
Okay, I would just like to add a point which was just made. Not only are more diabetics being prone towards COVID, but also the fact that extensive period of time steroids are being used in excessive dosage. There is also induced diabetes happening to people. People are who were not diabetics are also turning diabetic. So that's another factor which this is actually teaching us now. Coming back to what you asked me, the basic way these things work, these fungi work, is they enter through the nostril. They enter the nose normally. They go into your nasal cavities, then go to your sinuses, And if it is being treated, and if you suspect at that time, majority of the cases would come with an ENT kind of a symptom, right? But if it is not diagnosed very, very early, what happens then is it goes through the areas into the back of the eye, and
Yes.
also can enter into the gastrointestinal system, also can enter the lung system, also can go up into the cavernous sinus, and finally to the brain, into the meninges. So the reach of this fungus is extremely lethal. So the key to it is, to diagnose it very, very early and try and institute the treatment as early as you can. Now there has been a phobia because, unfortunately, for the last about 10 days, is this black fungus is being talked about in the media very extensively. But one thing to be very, very, which I need to point out now, is the fact that this nuclear cases is mostly being seen from people who are recovering from COVID. And after a period of 8, 10, 14 days, it is actually becoming symptomatic. So it is not very commonly during COVID that people are being found to be having mucor. It is later. Now, what are the symptoms? Apart from the fact that you get a stuffy nose, bleeding from the nose, some area of loss of sensation around the nose, typical of black patches. Black patches are necrotic patches, okay, where the blood supply is actually getting lysed and the tissues are getting lysed. The second thing, which it goes to the back of the eye, few of the important early signs in the eye are droop of the eye, lack of movement of the eye, swelling around the eyes, and then ultimately leading on to double vision because the muscles around from where the muscles are entering into the eye and moving the eye, they are getting affected. So this is a called orbital apex syndrome. So these are advanced stages by which time it could very well go, up to the brain. So we are getting a lot of referrals today. For example, today we had 7 referrals for ophthalmology amongst the cases which were admitted in Medanta in the hospital. And I have been given to understand that this is going on in nearly every multi-speciality hospital. Now, few of the cases which come very rarely are with lungs and the GI, the gastrointestinal symptom, and neurological symptoms. But the commonest is the ENT. Second would be the eye, and one very, very sort of typical thing is losing of the teeth. Some people have come with their teeth being lost as young people, and most of them are diabetics, and most of them have taken steroids. That's what the problem is.
All right, Dr. Pakrasi, one last question to you before we allow you to go on the treatment of it. And I'm again going to ask, Dr. Babu and Dr. Garg also. One of the problems in a pandemic like this, that people can't get medical advice, is they start thinking they can treat themselves. Now, I'm seeing requests on Twitter. People are saying, I'm going to get amphotericin, I'm going to do this, I'm going to do that. Now, of course, that's the treatment for black fungus. But some of these medications are dangerous by themselves. You can't just get it at home and inject it into yourself and think you're going to do well. So I guess that's a warning that should be done, and specifically for black fungus, because the treatment for this is potentially, it has side effects. It has serious side effects.
Yeah. So the main treatment, which is being followed is a lyophilized amphotericin B. Now, unfortunately, it is becoming, increasingly not available. The supply of it is not being available. And like we had the oxygen issue, I just really dread to think what's going to happen if this drug is not available. So there are cheaper varieties of them available, like the deoxycholate, not the lyophilized, which is a much lesser side effect in creating a kind of an antifungal drug. But the deoxycholate is actually a bit more toxic, but equally effective and cheaper. Now, the main problem is, which is being seen with that, is issues with the kidney. It actually does affect the kidney, so one needs to be very careful. The dosage, which is which has been advised, is 5 to 10 milligrams, which is to be given. But again, people are giving excessive dosage. Sometimes it's not being available. So there are stuff like posaconazole and other antifungals which are being used. Another last problem is that this, once started, has to be continued for 6 to 8 weeks continuously, and it is not really going to be affordable for majority of the people who are not going to be able to afford such expensive medication. It's not a very cheap drug.